Before we wrap it up, we've gone through Rux and then, if you may let me say, son of Rux. Are there any other pathways being targeted? BCL2, PI3 kinase? I mean, is this the only pathway that we're able to target in MF, or are there other ideas of how to move forward?
Sure. Well, fortunately, I think there has been a tremendous and justified interest in MPNs and myelofibrosis. And I think multiple things are being looked at in parallel, both alone or in combination. One I'd highlight would be PRM151. So this is an anti-fibrosing agent. It's a recombinant human pentraxin 2 molecule. And its impact is really against the monocytes and macrophages, and impacts really the fibrosing process, and the data has been seen in the early studies, both alone and in combination with ruxolitinib, with studies from Dr. Verstovchik, myself, and others, that is interesting, and it's acting in a different pathway. We've seen activity with other pathways, that telomerase inhibition, in combination with PI3 kinase inhibitors. More than one PI3 kinase inhibitor have shown preliminary activity. Rami, what about luspatercept?
Right, so that's the other pathway that, I think, TGF-beta pathway has also been a target within the consortium. We are starting a study in different way, but one of the elements in that pathway had been those, fusion trap proteins, luspatercept, that had finished clinical trials in MDS showing efficacy in terms of anemia, and had been tested in myelofibrosis. The study actually finished accrual now. A similar compound called sotatercept, also originally tested in MDS and in myelofibrosis, had shown early activity in myelofibrosis. It was a small study, around 15 patients, but there were responses. So I think the luspatercept may fill that unmet need of anemia for patients with myeloproliferative diseases. Hopefully the study will tell us more about the efficacy and the duration of responses. But the whole pathway, the TGF-beta pathway, is another pathway that's been actually looked at in several ways, in different trials with different medications. There are like the drugs like luspatercept. Again, that's a fusion trap protein. There are tyrosine kinase inhibitors that target that pathway. So we're definitely going to see more trials in that way. So,
and not to mention the combination studies. There's a whole slew of combination trap, PI3 kinase delta, et cetera.